Assalamu alaikum wa rahmatullahi wa barakatuh. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين والصلاة والسلام على سيد المرسلين محمد وعلى آله وصحبه أجمعين. Jazakallah khair for joining us today. As Sheikh Fazaga said, it is going to be the 20th anniversary of the Muslim Clinic. And I have some swag here, and if you can answer questions, you'll get some of it. So the best thing out of this is this water bottle. The weather's getting hot. You're going to need to keep cool water with you. This is a pretty good sized water bottle. It's got the clinic logo on it. That's if you answer the questions right. We also have some notepads that are clinic branded. You always need sticky notes when you're writing things down. And then we also have bags, tote bags. Carry your groceries, carry your stuff, carry your kids' things if you have children. So at the end of the presentation, I'm going to see if you were paying attention. And if you do, and you answer the questions right, then you can get one of these. So make sure you pay attention. So as Sheikh said, the Memphis Muslim Medical Clinic was first opened in 2006. Oh, it's on. Okay. There we go. Okay. Sorry, technical difficulties. So if you were here in 2006 and you were at the opening, raise your hand. Should be several people, right? Badr uncle, Dr. Zaman, Iqbal uncle, where is he? He was there as well. Several people were there. So this is a time, these are some photos that'll take you back to 2006. I was graduating high school at the time. And you can see Dr. Osmani, may Allah have mercy on him. He's cutting the ribbon. There's Dr. Nasir, Dr. Mukarram, who's not here. We see Dr. Ilahi back there. There's my dad, may Allah have mercy on him, Iqbal uncle. Dr. Zaman. We have others from the community as well, if you look. Some of our early patients, Dr. Motiwala, Dr. Khan. So the purpose of the clinic was to provide primary care for underserved and uninsured patients. Imagine the time. This was right after 9/11. And just like nowadays, our existence in this country was being questioned. Do we belong or not? Even though we've been here for more than 400 years, Muslims have. And the Muslim doctors in the community, a group of them, they got together and they said, we have to give back. In Memphis, there's church health, there's Christ community, but there's no Muslim clinic. So they looked at ideas they explored these organizations. They looked at Ummah Clinic in Los Angeles, one of the first Muslim nonprofit clinics in the country, who mashallah is now, Sheikh Fazaga told me, moving into a 2 million square foot building, mashallah. Or $2 million to move into a big building, $2 million grant to move into a big building and have their own x-rays and labs and everything in Los Angeles. And how did that clinic start? Medical students and residents. That's how they started it. So the goal was to provide evidence-based, excellent primary care for patients regardless of their background, whether Muslim or not. And so the clinic has fulfilled that pledge. They do provide evidence-based primary care. But I think we're at a critical point where we've reached a critical mass where we can do more, inshallah. And we'll talk about that. And several of you here in the audience, you're volunteer doctors here. Raise your hand if you volunteer at the clinic as a doctor. Dr. Zaidi, Dr. Farhan Aslam there, mashallah. I don't see others, but there are others, mashallah, who volunteer. May Allah bless you and give you jaza al-khair, inshallah. So it was opened in April 2006. Remember that. It's a nonprofit registered with the IRS, 501c3 organization. We've served well over 2,000 patients during the past 20 years. That's old numbers. We're past that number, mashallah. We're run by a volunteer board. We have paid nurses and staff and volunteer doctors. Remember, this is primary care. So this is what you would go to for your family medicine or internal medicine doctor. We see adult patients aged 18 on up And any medical condition, if you need an annual checkup, if you have high blood pressure, cholesterol, diabetes, if you need to be checked, you can come. Now, remember, this is for uninsured patients, for now. We can also refer people for subspecialty care. We also do labs. We charge a very minimal fee, $10 for office visit, $20 for labs, and we cover the cost of the labs for the patient. We also refer to get x-rays and radiologic studies, and then we do community education that we'll talk about. The primary care clinic is every Sunday from 9 a.m. to 1 p.m. We've also hired a nurse practitioner part-time and are doing a full-day Saturday clinic every other Saturday for now. We also have Dr. Robert Vestal. He, mashallah, is an ophthalmologist with Mecca Eye Clinic. He volunteers to see all of our diabetic patients and screen them for diabetic eye disease. And then we also have a gynecology clinic, which is done by Sister Amina Dafallah, Dr. Amina Dafallah. And we also can refer people to Sheikh Fazaga here for mental health services. And then we have a partnership with one of the local pharmacies, Plaza Pharmacy, who provides our patients with discount or free medicines. May Allah bless the brother who runs that. We also do health interpretation. We have medical interpretation services for the Arabic language, for Urdu, and for French, and Amharic. We're working on Fulani and other languages too. And we also have started a dental screening program in the past year in collaboration with dental students from UT and with Dr. Ashraf Hussain here, whose office is close to the masjid here. And then we also are working on a patient assistance program for those who qualify for zakat or sadaqah, inshallah. So let's talk about our patients. Our patients come from all over the Memphis area. There are patients who come from Memphis itself, from North Mississippi, from eastern Arkansas, from rural areas. We have patients, a lot of whom come from the 38122 zip code around Masjid Salam, but we also have patients coming from other zip codes, like 38107, 38109, 38126, 38123, historically underserved and impoverished areas, where access to health care and healthy food is not available readily. And it's a challenge. And like I said, we see adult patients. Our patients speak over 20 different languages, mashallah. Our patients come from a variety of backgrounds. We have people who are from different parts of Africa, from Asia, from the subcontinent, from the Middle East, Caucasians, African Americans, Hispanic patients. We have patients from a wide variety. The top conditions that our patients have are high blood pressure, high cholesterol, diabetes. Now, you may have seen in the news that there have been cuts to Medicaid funding and insurance programs. And the cost of Obamacare insurance, Affordable Care Act insurance, has also gone up. As a result, especially this year, a lot of people have been losing their insurance. So we have seen an increase in the number of patients who have needed primary care services. We've had about a 10% increase year on year since COVID. Really 2022, when we've been looking at it, in the number of patients who've needed our services at the clinic. And that speaks to the current situation in the country as well. Our patients experience barriers. They experience a lot of barriers. The number one barrier is the cost of insurance and the affordability of healthcare. As I mentioned, healthcare premiums are increasing into the hundreds of dollars for Affordable Care Act plans, and the coverage that they offer is decreasing, and the deductibles are going up. So it's hard for people to make ends meet. Do they pay for gas? Do they pay for their medicines? Do they pay for their doctor's visits? People are having to juggle this. This is real here in Memphis and across the country. The cost of medications are high, right? The patients who don't have insurance, they can't afford the newest evidence-based medicines. Like, for example, if you have a patient with diabetes and kidney disease, you would do an SGLT2 inhibitor, right, to treat their disease. You have different medicines that they can't necessarily afford. And then transportation can be a barrier, and then healthy food costs. A lot of parts of Memphis are in a food desert where they don't have access to healthy food, where they have limited food choices, processed foods or fast food type choices, and that doesn't promote healthy living. So we're here to try to help fill the void. Now, alhamdulillah, I will say that we are very blessed to have an amazing group of volunteers coming from the volunteer physicians and especially our volunteer students. We have, mashallah, an amazing and dedicated group of medical students from UT and also from the Baptist College of Health Sciences Osteopathic School of Medicine. And we also have a very dedicated group of dental students. We have pharmacy students on board now, and we have college students and high school students from PVS and other schools who are working very hard to make this project move beyond where it is now and go to the next step. And so these are the areas in which they volunteer. And if you're interested in volunteering, come see me, see Dr. Nasir, see Dr. Zaman, talk to one of us. We can get you hooked up with any of these areas. The medical interpreter program, dental care, patient assistance program. We're coming up with a sliding fee model based on patients' income to give them support from the clinic to care like specialty visits, or if they have to get imaging done, or affordability for medications. Pharmacy assistance program. We're working on developing a process to get patients plugged in with drug manufacturers to get medications at low or no cost if they can't afford it. We have the INSPIRE program, which is the Ibn Nafis Scholarly Research Project in research excellence that we have every summer and sometimes in the semester for students that are in college who are interested in medicine. This year, mashallah, the class from 2025, Yasmin Mannan and Zaid Hadidi, they did a qualitative research project on patient experiences, and they presented here in December. And their paper was accepted to the SFAA conference, which is the International Body of Anthropologists, their conference, their international conference. And their data was presented there. And they've been invited to present a manuscript, write a formal paper, and submit it to the body as well. MashaAllah. So there's that. There's opportunities for grant writing. We have opportunities for IT, web design, and rebuilding our website. Clinic operations, mentoring health students, people who are interested in health professions. And our volunteers, they spend countless hours trying to help build the clinic. And I will say, inshallah, as you'll see, that our programs are increasing and our goals, inshallah, are there to make this move to the next level, inshallah. We also do community education. This healthy living series that MIC does, it's in partnership with the clinic every month. We're going to be starting a healthy living series at Masjid Salam as well next month that the medical students are going to run. We partner with the different first aid teams at the masajid to do CPR classes and first aid classes. We do flu vaccine drives every fall. We also do health fairs and dental fairs twice a year. And we do the INSPIRE program to help students learn how to do basic research and how to study patient populations and find outcomes where they can help those populations achieve better health outcomes. So what are our goals? We have short-term goals and long-term goals. And I wanted to just kind of talk to you about our short-term goals. The number one goal is to enhance or increase the number of patients that we can serve from any background. And a part of that is we're working on a process to be able to accept patients who also have insurance and also still serve the patients who need it most who don't have insurance. We're also needing to increase our physician volunteer base. MashaAllah, our community here is blessed with so many doctors, MashaAllah. And may Allah reward the ones that help financially and also physically in the clinic and see patients. But we can do more. If you're a medical doctor and you have a background in internal medicine or family medicine or really any medicine, come talk to us about how you can help and help move this clinic forward, inshallah. We're also trying to increase the pool of clinical volunteers. We, mashallah, already have a backlog, but we can always use more volunteers. We're trying to grow the number of languages that we serve. Right now, we need the most help in languages such as Fulani or Wolof and in Somali. Those are some of the key languages that we need help in. And then we're trying to grow the INSPIRE program and make it not just summer-based, but throughout the year to have interns at the clinic that are doing research. We're also trying to recruit specialists. MashaAllah, we have a lot of specialists in the community. But we only have relationships with 2 specialists in our community to see our patients. Dr. Noman sees our patients who have endocrine issues, and Dr. Asaf sees our neurology patients. If you're a specialist and you'd be willing to see our patients, even with compensation, please talk to us. together we can make this move forward and help these people in need. And then eventually we do want to make our nurse practitioner or physician assistant full-time and have it during the weekdays as well and not just the weekends. Another thing that we're doing is working on expanding the hours, and that's going to be coming in the next month or two, inshallah. We're also opening a medical student-run clinic supervised by attending physicians, but medical student-run clinic as well to increase the amount of service that we can offer. And then, of course, we could always use your donations and your time and your money that Allah subhanahu wa ta'ala has blessed you with. These are some of the, I'm sorry? No, not right now. The brother asked, do we have a pharmacy right now? Not our own pharmacy, but we partner with a local pharmacy. But if you're interested in talking about that, you can talk to me afterwards, inshallah. So these are just some of the events that we've done in the past, some of the CPR classes, first aid classes, flu vaccine drives. This is volunteering at St. Jude right here for one of their run events, 5Ks. This is the dental fair and the health fair from last year that we did. So if you'd like to help, you can visit our website, muslimclinic.org/donate, or you can see the QR link here. If you want to volunteer, come talk to us. But that's kind of what I have. The Muhammad Ali, may Allah have mercy on him, he said, service to others is the rent you pay here on earth for your room here on earth. This is our philosophy right here. We're doing service, following the prophetic tradition, sallallahu alaihi wasallam, and hoping to achieve success for the sake of Allah subhanahu wa ta'ala. So that's kind of what we have. Jazakallah khair. Do you have any questions before we answer the trivia, before I ask the trivia questions? Any questions? Mm-hmm. Oh, yes. So Dr. Zaman makes a good point. So if anybody wants to make an appointment at the clinic, whether for yourself, or if you have family visiting from overseas and they need to get checked and have their medicines refilled, you can always call the clinic during business hours during the week from 12 p.m. to 4, and make an appointment, and we'd be happy to schedule you in the clinic to see you there. Any other questions? Okay, so trivia. The first item for the bag. When was the clinic, in what year was the clinic inaugurated? Raise your hand. You don't count. Sorry you didn't raise your hand. Yes, Dr. Hassan said April 2006. Jazakallah khair. And because you also answered, I'll give you a bag. Okay. All right. The next question. What are two of the languages that are offered to interpret here at the clinic? Raise your hand. French and Urdu. Okay. I'll give you that. I'm going to give you a notepad. Punjabi. Yes, I'll give you one when we go home. That's my grandfather, mashallah. Okay. I asked you a lot of different things, didn't I? Do we take patients with insurance? Raise your hand. Yes or no? Raise your hand. Who said yes? You're wrong, sorry. Yes. Yes. Correct. The answer is no. Not right now. Okay. Here you go. Okay, now this is a tough one. These next two are probably tough. And if you can answer one, you'll get the water bottle. What are the days and hours during which the clinic is operational? Sundays 9 to 1? Every other Saturday. Yes. Okay. Do you know the hours on Saturday? No, that's Sunday. Okay. Partial answers. 8 to 4 on Saturday. Yes, that's 100% correct. You guys are partially correct. So what should I do? I'm in a conundrum. Since I'll give you the bottle since you answered it fully. And then I'll give you a choice. Do you want this or the bag? Okay, so you get the bag then. Oh, here, take it. Oh, and I guess you get the mic too. All right. Now, one final thing. Please remember that our 20th anniversary celebration and our health and dental fair is on Sunday, not tomorrow. Sunday, April 12th, from 11 to 3 p.m. at Masjid al-Salam. Free health screening, blood pressure, glucose, eye screening, vision screening, I should say, and dental screening. Plus, we're doing a cookout, burgers and hot dogs, halal, of course. And then we're going to serve food at around 12 or 12:30. And then, inshallah, the presentation is going to be after Dhuhr at 1:30 about basically this presentation, plus some awards and recognition for our volunteers. So, are there any other questions? If not, Jazakumullah. Oh, Adam.
For the event on Sunday, it doesn't matter if we have insurance?
No, it's open to anybody. You can come, no problem. Any other questions? Okay. Jazakumullah khair. Thank you so much. May Allah bless you all, inshallah. سبحانك اللهم وبحمدك نشهد ان لا اله الا انت نستغفرك ونتوب اليك والعصر ان الانسان لفي خسر الا الذين امنوا وعملوا الصالحات وتواصوا بالحق وتواصوا بالصبر سبحان ربك رب العزه عما يصفون وسلام على المرسلين والحمد لله رب العالمين واخر دعوانا عن الحمد لله رب العالمين.
Assalamu alaikum everyone. Inshallah the masjid will close at 10:30. So we ask you to please pick up all your trash and your belongings. And inshallah we'll see you tomorrow. Assalamu alaikum.